Welcome to the Health Insights new video. In this video we will talk about symptoms of HIV versus symptoms of AIDS. The earlier a person is diagnosed with HIV, and starts treatment, the better their health will be over time. Some people don't get any symptoms during stages 1 and 2, and may not know they have the virus, but they can still pass on HIV. Some people notice flu-like symptoms 1 to 4 weeks after they're first infected. They often only last a week or two. This stage is called acute or primary HIV infection. Then, you may go for 10 years or more without further symptoms. This is called asymptomatic HIV infection. Even though you feel fine, the virus is still active in your body, and you can still give it to someone else. Once HIV has seriously harmed your immune system, you're at risk for diseases that a healthy body could fight off. Most people infected with HIV experience a short, flu-like illness that occurs 2 to 6 weeks after infection. After this, HIV may not cause any symptoms for several years. It's estimated up to 80% of people who are infected with HIV experience this flu-like illness. The most common symptoms are raised body temperature, sore throat, body rash. Other symptoms can include tiredness, joint pain, muscle pain, swollen glands. The symptoms usually last 1 to 2 weeks, but can be longer. They're a sign that your immune system is putting up a fight against the virus. But having these symptoms does not necessarily mean you have the HIV virus. This process can vary from person to person, but may take up to 10 years, during which you'll feel and appear well. Once the immune system becomes severely damaged, symptoms can include weight loss, chronic diarrhea, night sweats, skin problems, recurrent infections, serious life-threatening illnesses. If you have HIV and you are not on HIV treatment, eventually the virus will weaken your body's immune system, and you will progress to AIDS, which is acquired immunodeficiency syndrome. This is the late stage of HIV infection. Symptoms of AIDS can include rapid weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, pneumonia, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other neurological disorders. Each of these symptoms can also be related to other illnesses. The only way to know for sure if you have HIV is to get tested. If you are HIV positive, a healthcare provider will diagnose if your HIV has progressed to stage 3 AIDS based on certain medical criteria. Many of the severe symptoms and illnesses of HIV disease come from the opportunistic infections that occur because your body's immune system has been damaged. However, AIDS have different symptoms than HIV. Symptoms of opportunistic infections common with AIDS include coma, coughing and shortness of breath, difficult or painful swallowing, extreme fatigue, fever, mental symptoms such as confusion and forgetfulness, nausea, abdominal cramps and vomiting, seizures and lack of coordination, severe, persistent diarrhea. Hope this video will prove informative for you. Subscribe to this channel for more videos and don't forget to like and share.